Good evening, everyone. The February 22nd, 2021 special joint meeting of the Recreation and Education Committee and the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Alcoffer.
Here.
Mr. Alcoffer is present. Mr. Baines.
Here.
Mr. Baines is present. Ms. Boyce.
Present.
Ms. Boyce is present. Mr. Colby.
Here.
Mr. Colby is present. Mrs. DeFlorio. Mrs. DeFlorio.
Here.
Mrs. DeFlorio is present. Mr. Flagler Mitchell.
Here.
Mr. Flagler Mitchell is present. Ms. Hassman.
Here.
Ms. Hassman is present. Mr. Hebert.
Here.
Mr. Hebert is present. Ms. Lamar.
Here.
Ms. Lamar is present. Mr. Lee.
Here.
Mr. Lee is present. Mr. Marionetti.
Here.
Mr. Marionetti is present. Chairwoman Smith.
Here.
Chairwoman Smith is present. Mr. Wilt.
Here.
Mr. Wilt is present. Mr. Udelson. Mr. Udelson is present.
Our next item on the agenda is a presentation by Dr. Mendoza, Commissioner of Public Health. Before I welcome Dr. Mendoza, we do want it, per the email we received from his office, he has prepared a 10-minute presentation, spoken remarks only, no slides. Once the 10 minutes is up, we'll need to yield the floor to the county legislators who have questions.
Great. Thank you, Chairwoman Smith, and thank you to all the legislature who is here tonight. I hope that tonight is a good opportunity for us to clarify a lot of confusion that I think I've heard in the media and the press from many of you. We've certainly heard a lot from our public, very important concerns from them. I think we can all agree that we want to have schools open, but I think we can also all agree that we want them to be open safely. And when we took the unprecedented step, the school districts took the unprecedented step last spring, almost a year ago now, to close down the schools, nobody had any anticipation that we would still be where we are today. But the reality is that this pandemic has evolved such that we are not yet at the place where we can have schools fully reopened 5 days a week as they were 2 years ago. I think we are making progress toward that day, and I will share with you later tonight some of the good news that I think we can look forward to. But I also want to clarify a little bit of the process, because I think a lot of the confusion around reopening has to do with who's responsible. And at some level, we're all responsible. I think the best predictor for us to reopen schools is to have a low community transmission rate and a low positivity rate. To the extent that we can all do our part as community members in Monroe County to keep the transmissions low, that is how we are able to reopen schools safely. So going back a year ago, when we first learned of the first case here in Monroe County, there was a lot that we did not know. We were learning a lot then. There wasn't really any organized guidance for what to do, but the school superintendents got together and they made the decision. Even though the first case was in one particular school district, all of the school superintendents made the joint decision to close at the same time. There was still a lot that was unknown. It was unknown how prevalent the COVID virus was in our community, and they all made that decision together. Remainder of that spring, we were trying to reopen. And I began meeting with the superintendents weekly, probably in the end of March, early April. And one of the frequent questions was, when can we reopen blank? Whether it was classrooms, whether it was graduations, whether it was sports or activities or what have you. We've always looked for ways to reopen while doing so safely. I think we need to owe a huge debt of gratitude to our superintendents who have always been looking for the best of the health and safety of their students, their staff, their faculty, and ultimately the community. So I think we owe them all a debt of gratitude. So you'll recall that in the summertime, the rates went down quite substantially. And I think that's a reflection of what we now know, which is that transmission of COVID-19 is very, very unlikely outdoors. We've learned a lot about the transmission, and apart from the relative safety of the outdoor environment, masks and distancing are the two most important features that we've learned with regard to transmission, particularly indoors. In around August, the state health department issued their first, or I think second at the time, set of guidelines for schools as to how they were to conduct school activities come this past fall. And those guidelines were dated here. I have a document dated August 14th. All of my counterparts in the region, and by that I mean Chemung, Genesee, Livingston, us, Ontario, Orleans, Schuyler, Seneca, Steuben, Wayne, Wyoming, and Yates, we all got together and we issued a joint statement essentially summarizing what was in the state guidance. And we all spoke at length at the time because our feeling was we wanted to have consistency across the region with regard to the meaning, if you will, of the state guidelines. And so I will read to you what was in that, and this is really a distillation of what is in the state guidelines. So regarding masks and social distancing, face coverings are recommended at all times, but required whenever individuals cannot maintain a 6-foot distance from other individuals who are not from the same household. Number 2, schools must ensure 6 feet of space in all directions between individuals at all times unless there is an appropriate barrier between them, unless the core activity, such as instruction, moving equipment, using an elevator, traveling in the hallways, requires a shorter distance or individuals are of the same household. I point those two things out because those are in the state guidelines. And when we issued our statement as a region, we essentially copied from the state guidelines and issued that all to all of the school districts in our region. And then it was up to the schools to develop their own plan. And they developed their school reopening plan and submitted it to the State Department of Health, who then had the authority to approve or not approve that plan. I think there's a lot of confusion around this. I do not have any role whatsoever in approving or not approving any of those plans. I have not read a single one of those plans, although I can tell you what I think is in many of them because we talked a lot about it. And a lot of the school districts wanted to know, how to proceed. But ultimately, they submitted their plans directly to the state health department, and it's only the state health department that has the authority to approve or disapprove of those or change the guidelines as they wish. So that's where we were in August and September. The Reopening Schools Safely Task Force was then convened in September, where we convened stakeholders, parents, teachers, staff, health officials, physicians, hospital systems from across the region to keep an eye on the scientific guidance as it came out. But ultimately, our job was to inform the school superintendents and the school districts, and it was up to them as to how or in what ways they wanted to adopt the guidelines as they came out. So to clarify, my role has been to offer clinical advice, sort of interpreting to some degree, this mask versus that mask, which one's preferable, those kinds of questions in terms of, taking meaning out of the guidelines. Reviewing the epidemiology of where we are in the pandemic relative to the prevalence, the transmission rates, what we're learning through contact tracing. And then my role is also obviously to oversee the health department, whose main authority is in implementing the quarantine and isolation guidelines for if and when we find a case in a school or any part of the community. And to reiterate, it's not my role to review any of these plans, to direct the schools in any way. I offer clinical guidelines, clinical recommendations, but ultimately, I've told the superintendents this, ultimately it's up to them, between them and the state health department as to how they wish to proceed with reopening. So we've learned a lot. We've learned that masks matter. We've learned that 6 feet distancing matters. We know this because here in Monroe County, I took the approach very early that I did not want to automatically quarantine entire classrooms when there was a case in a classroom. A lot of my counterparts used what is called proximate contact and implementing their quarantining, meaning that if there was a positive in any classroom, the assumption was that everybody might have been exposed and that they would close the entire classroom, quarantining it for the then 14-day, now 10-day period, and then go from there. Here in Monroe County, we took the position that masks matter. And so if 2 people are wearing masks, even if they're at 6 feet apart, we wouldn't necessarily quarantine them. We would look at the situation on a case-by-case basis, and we would do everything we can to not quarantine people who we thought were not going to be at great risk for transmitting the infection. And as it turns out, I think that was the right call. We have managed to not quarantine nearly as many people in schools here in Monroe County as have in other counties, and I don't think we've seen any untoward effects from that. And I will say on the topic of barriers, I know this will come up. My scientific opinion on barriers is that there is not enough evidence to recommend for or against barriers. And I've become a little bit of an expert on plexiglass, more than I ever thought I would. And I have not seen any consistent evidence, scientific evidence, for or against. But there are many guidelines. In fact, there are no guidelines that recommend plexiglass. There are no guidelines that I can find. The only one that I can find is the Harvard Public Health paper, if you will, that was, I think, issued in August. But since then, I've seen a lot of writing, and the most recent, which we'll go into in some more detail, from the CDC. Plexiglass and barriers is not mentioned once in this guideline. So the CDC guideline we'll talk about in a little bit. And we could talk more about that. Ultimately,
yeah, excuse me, Dr. Mendoza, I'm sorry. I know we have quite a few questions to get to, and I know you originally stated a 10-minute presentation. Do you think you could wrap it up in the next 2 minutes for us so we can get to some of the questions?
I can take questions now. I think
okay.
What we can do, because I want to show the CDC guidelines, because there's a lot. Yeah, we could show that as we go. That's fine.
Legislator Baines, Madam Chairwoman. Legislator Baines, Madam Chairwoman.
Please. I did, yes.
Yeah, okay.
Legislative Baines, thank you. Can you hold 1 second? I just wanted to just kind of give some guidelines around the questions. As you know, the procedures of committee of the whole and our monthly full legislative meetings will be using the exact same. When you wish to speak, simply state your name and you'll be called upon. No one's going to be left out. We know there's many questions to be asked and many questions to be answered. We prefer only one person to speak at a time, and when you finish, please yield the floor. I am going to take this time myself. First, I just have a few questions to ask Dr. Mendoza. So Legislator Baines, if you mind, I'll select you next. Dr. Mendoza, thank you for being here tonight. I want to appreciate the time that you're spending with us to explain some of the guidance. We do have a few questions. I thank you for that presentation, but we do have some questions to go a little bit more detailed. One of them is, you had stated that, are you stating that Monroe County Department of Health had no involvement in the reopening of our school process then?
We have a role in that I meet with the superintendents and I share the latest science and I offer my clinical recommendations. But as to the process of reopening, that is entirely between the school districts and the state health department.
Thank you. So how often do you meet with the superintendents?
Weekly, with a couple of exceptions in the summer, but generally weekly.
Okay. So you have been just providing assistance and guidance to them as they prepare for their reopening plans?
That's
or
correct.
as they go forward?
That's correct.
Okay. Thank you. Has there been anybody else within Monroe County Department or any administration that has given any authority over the schools, such as the county executive or any other executives within Monroe County?
Not to my knowledge. The schools submitted their plan to the state health department. I don't see a role for the county exec or any town or village supervisor or mayor. It's strictly between the school districts and the state.
Okay, thank you. And just so everybody knows, many of the questions that are coming before Dr. Mendoza tonight are really questions that we've been receiving from residents within Monroe County. So, and we just want to make sure we overarching get an understanding, so not only us as legislators, but residents understand what the process is. So thank you. So when, as you stated, when in August in 2020, and the governor had said that there would be submitting of the plans, you stated you didn't have any interaction as far as looking over any of the plans that any of the schools submitted?
I've not seen
for reopening?
Not seen a single one.
Okay, thank you. All right, great. Legislative, I'm going to yield the floor now. Legislator Baines, did you have a question?
Yes, thank you, Madam Chairwoman. Dr. Mendoza, I want to thank you for how hard you've been working all these months. And I know you put yourself out there, worked weekends, and I appreciate it. My first question is, what schools, public schools in Monroe County, if any, have you closed, by your decision?
I don't have authority to close a school. We would close a classroom potentially because of cases in a classroom. If I were to want to close a school, it would come in the form of a recommendation to the superintendent based on contact tracing data and so forth, but I don't have the authority to close a school down.
So let's talk about reopening, the subject of our, through you, Madam Chairwoman, to Dr. Mendoza. Let's talk about reopening. What direct involvement would you have in the decision, the governance decision, not the consultative role of collecting information, sharing, and disseminating science? What specific involvement would you have in the decision to reopen any school in Monroe County?
At most, it would be a recommendation, but it's not my role to recommend unilaterally. I think schools are different. I think school districts have different abilities to implement their instructional program. So, you know, and I'm not an expert in schools. I'm an expert in public health and science, and my job has been to represent the evidence as I see it to the best of my ability, and then translate it to what that might mean to a school or a classroom or to a teacher. But I think the decision making about schools is best left to schools.
Thank you, Dr. Mendoza. I've spent 45 years in schools. I'm still a teacher, and I haven't missed a day of work this year. So I do have some expertise. I don't portray myself as having the ultimate expertise. So my question, to you is, isn't the authority vested in individual school board members via their election, and in an individual school superintendents versus, via education law? These matters of jurisdiction and authority are strictly statutory. I'm assuming there are statutory guidelines for your jurisdiction and what you can control and command within, your own governance catchment area, if you will, as a leader. Isn't it the case that the structure of the state of New York education system, particularly as it relates to public education, is not governed by you, but governed by education law and locally elected school boards?
That's my understanding. We enforce local and state sanitary code, and that's what gives us the authority to close restaurants down, for example. But I'm not aware of any such legal authority to do anything of the sort regarding schools.
So, Madam Chairwoman, before I yield, I'd like to make a comment. And I think we've seen on the national level a lot of posturing by politicians and efforts to push blame, et cetera, away from themselves. In this case, it seems to me we're interviewing Dr. Mendoza about an issue, reopening schools, over which it's very clear by my research and by his testimony, if you will, or comments, that he actually has no authority to reopen schools, nor does he have any authority to close them unless they're in the midst of some type of epidemic spread or toxic event of some sort. So, my suggestion would be that if we want to have a hearing, we bring in the people who actually can make the decision. And I yield my time.
Thank you, Legislator Baines.
Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. Through the chair to Dr. Mendoza. So just to clarify, and the reason to clear any confusion up that Legislator Baines might have, the reason, at least in my opinion, that this meeting was encouraged today is because of the confusion and miscommunication. Apparently there appears to be within school superintendents as well as the parents who are communicating directly with our school superintendents as well as school boards. When I received an email last week directly from a parent who emailed her school superintendent with regard to school barriers and their school plan for reopening. And the school superintendent responded to the parent with this exact quote: "I have sent a proposed 3-foot distancing plan to our county Department of Health. In addition, we offered to place barriers around and between desks in classrooms. Both were denied. I do not know why Perry's plan was approved, other than that the Wyoming County Health Department authorized it, and the Monroe County Health Department did not." So again, there is confusion in our community with regard to who has authority and who does not. I'm not sure why the school superintendent thinks that you are approving or not approving plans, but this isn't the only example. Many of us have heard similar examples from our constituents. So I guess my question to you, Dr. Mendoza, is, are the school superintendents clear that you have not approved it or denied plans? And I guess I'm wondering why multiple school superintendents think that you are approving or not approving plans.
I have no idea why they think I'm approving plans. I've not even looked at a plan. So, and I'm not even familiar with what you're referring to with regard to the barriers of the 3 feet approval. I have honestly no idea what you're talking about.
Well, I do know that there was an article last week in the Syracuse, I think it was Syracuse.com or Syracuse newspaper, that indicated that Onondaga County was considering looking based on evidence and data that they were going to be reducing their, looking at reducing barriers from 6 foot requirement, I'm sorry, not barriers, distancing from a 6 foot to 3 foot. And that they would be making a decision. They indicated that New York State told the county that in-person instruction could happen based on social distancing guidelines of 3 feet, and that it was a local health department decision. So again, I think it's clear that there's a lot of confusion because different counties are telling different people different things. So again, I guess my question to you is, ultimately, who is making the decision? Is it the state? And when we say the state, does the State Department of Health have authority over our school districts? Does Governor Cuomo, based on his executive power, have authority over our school districts? Who is the ultimate decision-making authority?
It's not the local health department, I'll tell you that. I spoke to Dr. Gupta within the hour, just to clarify, because I've been hearing the same reports too. And she told me that she has not made any such decision. It's not ours as local health departments to make. I'm happy to review the scientific evidence on 3 feet versus 6 feet versus plexiglass. And the most that can result in is an interpretation and a recommendation to the community. But ultimately, if the state health department doesn't give the green light for any of it, it doesn't matter what I think.
So again, just to be clear, through the chairwoman to you, the ultimate decision maker then is the State Department of Health.
I think it's the State Department of Health, yes. And I don't know how they do that at the state health department, either between the state ed or state health, but it's not a local decision. And
is that decision, and I'm not sure if you know, or if this is a question for the county attorney, who I believe is also on the line, but is that authority based on local state law pre-COVID, or is that authority based on the governor's executive authority?
Okay. Last thing you want is legal advice from a doctor, so I'm going to ask the county attorney.
I appreciate that. Thank you.
Sure.
Through you, Madam Chair, that is based on state guidance that has been issued as a result of the state's emergency powers.
So just to follow up then, if and when the governor's executive authority ends, the state would no longer have the authority to make those decisions, and it would go back to the local school districts. Is that correct?
Through you, Madam Chair, it'll depend on the circumstances and what happens with the state's executive authority. I guess I'm hesitant to speculate about that because I could see that the way that authority changes going several different directions. But yes, typically it is a local school district decision.
Thank you. And then through you, I'm sorry, through the chair to the administration, this is back to Dr. Mendoza. So just kind of circling back to the whole guidance and guidelines that you've been giving to the school districts. And I'm just curious, has the guidance and guidelines changed over time as the medical data, or I'm sorry, the data and scientific evidence? And I mean, we know a lot more now clearly than we did almost a year ago when all of this was starting. And even since September, when a lot of these plans were submitted. So I'm wondering, just in your medical opinion, have these guidelines changed, or has your thought process with regard to the guidelines changed since August, September?
So the actual guidelines have not changed. The state guidelines that are that are relevant here have not changed, to my knowledge. The state has not issued any new guidelines governing the schools. That being said, there's been a lot of scientific knowledge that has been gleaned over the last 6 to 8, 9 months since schools have been open. And I've done my best to try to reflect what is known for and against, just in the spirit of transparency to the school districts. And I believe that if they're listening, I hope that I hope what I'm sharing with them is helpful. But ultimately, it's their decision, in my view, to make any changes to their plans and submit those to the state. Now, obviously, when we were heading into October, November, December, there was a lot of trepidation with the numbers being what they were, and there certainly wasn't any huge push among the superintendents to want to reopen then. I do remember probably in October thinking to myself, what would the circumstances be to start to reopen? And it would have been at the time to find the school districts or the areas with the lowest prevalence rate and essentially start to do what ended up being what was issued in the CDC's guidelines on 14th of this month. And we could talk about those. Those guidelines, I think, are the best scientific evidence, if you will, governing how to reopen schools to date. It's been what we were looking for. It's what I was going to try to develop on our own based on what we were seeing here in Monroe County back in the fall, and then everything sort of went south with the numbers, and so we put that on hold. But what the CDC has put out 2 weeks ago, I think, is a good roadmap. And I actually don't think, if you look at the guidelines closely, we're actually not that far from reopening and changing. Because you'll see in the guidelines that it says to implement 6 feet to the greatest extent possible, which leaves a lot of wiggle room in terms of 6 feet. Now, it's not on the table when you're in the they call the high or the moderate risk transmission rates, and we're currently high along with 89% of the other counties in the United States. But if we got down to moderate or low, I can see a path toward reopening in under those circumstances, as long as the state health department approves it. I will make my recommendation to the school districts based on that evidence, but ultimately it has to be the state health department that gives the schools the green light if they were to incorporate what's in the CDC guidelines into their plan.
So through you, through the chair to you, Dr. Mendoza, what would it take to get us to that rate?
So by my calculations, right now, our total new cases per 100,000 on a 7-day rolling average is 142. We would have to get down to 53. Sorry, 370. Wait, no, hold on here. 53 per day. It would have to be 370. 53 a day is what I wrote down. Would have to be our daily average to get down to that moderate risk. And we're averaging in the low 100s right now. So we'd have to get to 53 per day on average for 7 days. And we're at 142 now.
And just to be clear, those are total positive cases.
Correct. The cases per 100,000, new cases per 100,000 as a 7-day rate is the first metric that is used in the CDC guidelines. The second one is the positivity rate, and we're already in the lowest category for that. So the new cases per 100,000 is the metric that we'd have to get lower. And by my math, it would be 53 a day on average, or 370 per week.
So one additional question, and then I'll yield the floor. I remember back in April, May timeframe, when a lot of talk was done about testing and the appropriateness of tests, I clearly remember you talking about the 30% false positivity rate at that time. Have the tests gotten better, or do we just not talk about those false positives anymore?
So false positivity rate is the feature of the test itself. What matters is the positive predictive value, and that incorporates the known prevalence in a community. So we have more tests on board. We have the Androgen Test now, which we know to be quite reliable in detecting contagious disease. It's not necessarily good at detecting PCR positivity, but it is quite good at detecting the the contagiousness of that individual. And that's what had been used in the fall for the testing in the schools, for example. But the test technology has not changed. The 30% false negative rate on day one of symptoms is still true for the majority of the PCR tests that we're using in this community. So those properties haven't changed.
I guess I'm looking at false positives, because wasn't there a concern of false positives back then as well?
So so we've learned a lot more about the false positivity rate as it pertains both to symptomatic or asymptomatic disease, as well as the time at which you get the test done. We know that the PCR can remain positive for weeks. So if you check a person who's had known COVID and you check their PCR nasal pharyngeal swab in 2 weeks, odds are quite good that it will be positive. It's true positive in that there is, genetic material in that person's nasal tract, but it's a false positive in that the person's not contagious. So it really depends on, the point at which you do the test, but the actual false positivity rate is a feature of the test, and that doesn't change with prevalence rates.
So I guess my concern is that we're banking on reopening our schools based on data that has weaknesses to it.
Well, there are always weaknesses in tests. And these are the standards that are used across the country. Our rate right now, our new cases rate is quite a bit higher than the threshold. And by a lot of estimates, anywhere the actual new cases in a given point in time is anywhere from 3 to 5 times the measured new case rate. So all we can tell you is what we're seeing. We haven't changed how we've been obtaining these tests for months now. And so the rate is what it is.
I'll yield my time. Thank you.
Legislator
Hebert.
I'd like to respond to the comments regarding me, Chairwoman.
1 second, please. Legislator Hebert, you have the floor.
Thank you, Madam Chair. Through you, Madam Chair, to Dr. Mendoza. I want to go back to a couple of things Legislator DeFlorio mentioned. The Ontario County Executive stated that the state had given them permission to reduce social distancing. Is he just flat wrong?
I don't know what they told the Ontario County Executive.
Through you, Madam Chair, through to Dr. Mendoza again, are we doing anything, is the administrator, well, is your department, because you can't speak for the administration, but also to the administration, is anybody doing anything to check on that to see if in fact you could be delegated that responsibility?
That's, I don't know how to answer that question. It's not something that's within my authority at this time. I can't comment on what the county, administration is doing on that, but it's not in my authority at this time.
Through you, Madam Chair, someone from the administration on the line that could answer that.
Is there anyone with us from the administration?
All right, let me move on to the next question.
We can have the county attorney can perhaps field that question. Hold on.
Through the chair, as Dr. Mendoza said, it's certainly my reading of the state guidelines that there is no authority for local health departments to do that. We can get back to you, Legislator Hebert, on your question of whether it is possible to ask for such authority. I'm not aware of any mechanism for getting such authority.
Thank you for your information. Through you, Madam Chair. The Onondaga County Executive over the weekend made the announcement that they had been given authority to do so. And I would encourage us to try to get the same authority if it exists, even though you don't have it today. It might well come in handy. Also, a follow-on question through you, Madam Chair, to Dr. Mendoza. The Greece District Superintendent and School Board basically announced today that they sent a letter to Governor Cuomo asking for the 6-foot distancing requirement to be reduced. Do you support that request?
Not right now. With the community positivity rate that we have, that would not be consistent with the CDC guidelines.
All right, thank you. Through you, Madam Chair, to Dr. Mendoza. Relating to the testing questions that Legislator DeFlorio just asked you, given that we know that there's that there's false positive testing, and in fact, I read a Harvard School of Medicine article estimating that at 20%, that was published in early January. I would like to ask you if pushing to do additional testing in schools is a good idea, given that the student is, if they get a positive test, they're relegated to some restricted area, immediately taken home, and in all likelihood, I'm suspecting the health department is quarantining the whole family. And I think you get the gist of my question. I'll let you answer.
Testing is a good thing. The rapid antigen tests, the ones that we had used in the schools, have been shown actually since we used them to be very, very good. I think 96%, but don't quote me on that, but somewhere in the mid 90% at detecting contagious disease. And so if we can identify people who are contagious and keep them out of the school, that's a good thing for the schools and a good thing for the individual, but really a good thing for the schools, because if we can ensure with reasonable certainty that there is no disease in the school, we don't need any distancing. That's the whole idea with testing, is if we can exclude people from school who are positive, or know that because the community positivity rate is so low that the risk is exceedingly low, then we don't have to have a conversation about 6 feet or 3 feet or plexiglass. Then we can just go back to normal. And I think that's the goal that we all have.
Clearly, through Madam Chair, Dr. Mendoza, it is clearly the goal we all have. Full in-time learning is, I think, undoubtedly best for the student. I think even Legislator Baines would agree with me on that. The question I want to follow up with on that is, given that we are sending kids home who are not testing positive, who are in fact not positive. In fact, I had a constituent tell me it's happened to her child 3 times already, which I find hard to believe given the time frame, but that's pretty severe. Does the state mandate continued testing? I thought they had removed that requirement of the testing in the schools.
Right. That testing requirement went away with the zones, and in fact, there was a point at which even the yellow zone testing expectation was loosened up. And it used to be, I think, 20% per week, and then it became 20% per month. So that changed pretty dramatically. And I don't remember doing any testing in schools on a mandatory basis, at least in December, if not November. I had always encouraged the schools, if they wanted to test for their own, purposes, that they are voluntarily, invited to do so. But it had not been required for quite some time. After those first couple of weeks where we saw the rate was so low in the schools, I think we saw that there wasn't really a need at that time. But you will recall that was before the numbers started to surge in November and December. So, nobody will know what it would have been in December, but, maybe a little higher, but not that high.
So through you, Madam Chair, to Dr. Mendoza, you have encouraged the schools to continue testing, it sounds like, which is above and beyond the state requirement.
I've encouraged them to consider it. Yeah, I think it's a good thing to know. I think it can provide reassurance to the community and to teachers who are nervous. And I think, and if you look at the CDC guidelines, there are 2 pathways. There's a pathway for schools that do not do screening testing, and then there is a pathway for those who do screening testing. And the mitigation strategies are different. When you are doing screening, you have a better sense of what you're dealing with, and you can apply the strategies for mitigation in a more sophisticated way.
Through you, Madam Chair, I have read that documentation in its entirety. Is there medical evidence that students, especially younger students, do not become infected with COVID-19 as readily as adults?
As early as adults?
As readily as adults.
They don't get as sick as adults. The rate of asymptomatic carriage is probably higher in students, so we don't necessarily know in those who are asymptomatic, because they never get symptomatic and don't tend to get tested. So as far as getting it earlier or not, I have to look that up, but Yeah.
Again, I didn't say earlier, I said more easily. You know, are they as readily infected as an adult?
No, I think adults are more readily affected. But it's hard to know because we haven't done any actual, clinical trials on this.
Well, that's what the Harvard School of it, Harvard Medical School says, is that the children are less likely to become, less likely to become infected if exposed. You've referred a number of times to the CDC's new operational guidance for K-12 schools, which came out on Friday, the 12th of this month.
Mhm.
In that, it says, and I quote, "Vaccination for teachers and staff and in communities as soon as supply allows is recommended. However, access to vaccination should nevertheless not, and I'll repeat the word not, be considered a condition for reopening schools for in-person instruction." And then, of course, it goes on to say that even after they're vaccinated, schools need to continue mitigation measures for foreseeable future and stuff. What's your view on vaccinating teachers?
Vaccinating teachers is a good idea. You'll recall that the CDC guidelines refer to reopening as schools that are not at all in person to going either to hybrid or full in person. But what we're dealing with in our community is, in most cases, most school districts are in some form of hybrid learning. But I agree with the CDC that it shouldn't be a requirement, but I think vaccination of teachers is a really good thing. And the more we can vaccinate teachers, the more we can be assured that they are safe from contracting COVID, not so much from the students, but from one another. That's the highest risk in the school, this teacher to teacher. So I would want our teachers to get vaccinated as soon as they can.
For the record, through you, Madam Chair, I would like to see everyone get vaccinated as soon as they can. Some of your words most recently, a couple of your tweets, Dr. Mendoza, are very, very positive about the effect of the vaccines impacting everything. I'll try to keep it to just a couple more questions. I have many, however. In the CDC guidance, it says again, and I'll quote, "In-person instruction should be prioritized over extracurricular activities, including sports and school events, to minimize risk of transmission in schools and protect in-person learning." In another section, it says that the first thing that we should open our schools and the last thing we should close our schools. What's your view on that prioritization, especially given that we have now allowed sports to happen? And I believe that was with your approval, because I think that came to the county to have to approve it, didn't it?
Yeah, I said it before, I'll say it again. I agree. Schools should have been the last to close and they should be the first to reopen. And we were all surprised as health departments when that guidance came. I remember because it was a Friday afternoon, indicating that sports could proceed. And, I think that our school districts in this community have done a fabulous job trying to protect their students. I think it was the least that we could do to restore some sense of normalcy. I think sports are extracurricular, so it's not the same thing as regular instruction, which is not extracurricular. I also think that sports are somewhat easier to do contact tracing in, which is why I felt that it was a reasonable approach. But frankly, reopening sports is far easier than reopening schools. So I felt that it was reasonable to entertain. I would have rather have schools opened first. But I think given the circumstances and given how difficult it will be to reopen schools and given the guidance now, it may not be for a little while. I think that if we can restore some sense of normalcy for these athletes, I think we ought to do that.
Thank you. Through you, Madam Chair, to Dr. Mendoza, is there any evidence of other medical problems such as psychological, depression, anxiety, et cetera, created for students because of the restrictions on in-person education?
Absolutely. And we cannot underestimate the mental health trauma that this pandemic has taken and all of the things that are rolled into it. It's not like it's good versus bad. It's sometimes, two things that are trade-offs. And I think and that's why I think the schools have a really hard call. I can make recommendations about the incidence of mental health concerns and infections and so forth. But, when it comes down to it, I think the school districts have to consult with health leaders and parent leaders and others to make that call.
Quick, probably yes or no. Have any psychological professionals through you, Madam Chair, requested you consider advocating or ruling to change school reopening plans?
Have mental health professionals asked me to change the school reopening plans? No.
Okay. There are mental health professionals claiming we're also in the middle of a COVID-19 driven mental health pandemic through you, Madam Chair. And they don't think that mental health aspects are being treated with nearly enough respect. What's your view on these opinions?
I think it's true. We've not treated mental health illness properly for decades. And I think the pandemic has shined the light on that disparity in the same way that it's shined the light on almost every other disparity in health. We need to do a better job with that. But it's a hard trade-off. It's a really hard trade-off.
Through you, Madam Chair, Doctor, do you believe poor and underprivileged students are being impacted differently medically due to COVID-19 restrictions?
Oh, medically? Communities of color have borne a disproportionate impact of the pandemic. And I think it's a result of decades of structural factors that have made them more at risk from contracting the infection, as well as suffering untoward health consequences from it. Our health systems are doing everything they can to address those healthcare disparities, but we know they still exist, which is why it's so important to prevent COVID infections through vaccination and ensuring that we have an equitable distribution of the vaccination across our community, because that is our best hope of at least righting to some degree some of these wrongs. But it will take us, decades to unpeel a lot of the disparities that we've now shined a light on as a result of this pandemic.
I'm going to ask you one last question for now, Doctor. Through you, Madam Chair, has the impact on school closures had any additional medical impacts on children in the early intervention or pre-K special education programs?
So we saw a decrease in referrals from primary care to early intervention in March, April, and May, I think, of last year. And I have to believe that those kids, because then we saw a concurrent spike in referrals in June, July, and August. So, there were 2 to 3 months there where those kids presumably could have gotten in sooner, but because for whatever reason, either because we in healthcare were not open or not doing the preventive care like we normally do, or because parents were nervous about coming into healthcare settings, or probably a combination of both. But the beauty of early intervention is that it's early. And we missed the boat on some of those, unfortunately. And this is true across the country. This is one of those many, many side effects of this pandemic that we're going to have to dig ourselves out of in the years to come.
Just a closing comment. I'm on the New York State Association of Counties Children with Special Needs Committee. A lot of local people know that. I have received untold number of calls or emails or texts from people indicating that the reason they've opted out of remote learning opportunities is it simply doesn't work for them for a wide variety of reasons. We need to get those kids back in school as soon as possible because early is gone. We've already lost a year for a 0 to 3-year-old. I yield the floor, Madam Chair.
Mr. Chairman, I ask for the floor, please. Member Colby.
Those remarks 2 different times.
Legislator Baines, you have to wait your turn to the second turn.
I was just referenced twice.
Okay, everyone's going to have a chance. Legislator Baines, we do want to let all legislators have a chance to ask questions and answer because Dr. Mendoza is limited. You did have a chance. We will be circling back to legislators that did already ask questions. So I am going to allow Legislator Colby to go ahead with any questions he has for Dr. Mendoza. Thank you.
Thank you, Madam Chairwoman. I just
thank you, Chairwoman.
These legislators are referencing
Legislator Chair, I have the floor. Through you, Mr. Chairman, to Dr. Mendoza. My understanding is a lot of the secondary private schools are open 100%. Is that your understanding too?
I don't have data on that. I'm aware of some high schools, and one in particular I know is open because they have space to achieve the 6-foot distancing. My understanding of those situations is that they have the square footage that allows them to do that. But again, this is because they've submitted a plan to the state and the state has approved it. So that, I think if a school had that square footage, they could just as well submit the same plan and do the same thing.
As you stated earlier, you meet weekly almost with most of the superintendents. Are the private schools included in that meeting?
Not in that meeting. I do separate meetings with the privates and the charters.
Why did you do private meetings with the different schools? A school is a school, I would think, through you, Madam Chairman.
Well, it seems to me that the districts seem to have different not interpretations, but different issues than the smaller schools do. Mostly it's just a matter of convenience. I just do 2 meetings.
Okay. Through you, Madam Chairman, since you're having different meetings with different schools, do you have meetings with any other organization revolving around schools opening or not opening, such as the teachers unions or any other employees group?
I think I've met with the teachers unions twice. I met with the School Boards Association once or twice. I think that's it.
Have you met with any parent organizations on this issue? Through you, Madam Chairman.
The Reopening Schools Task Force has 3 subcommittees, and there are parents on each of those, and I've met with them.
Okay. Through you, Madam Chairman, since some of the private schools or a lot of the private schools are open fully, and so we have a track record with them, have you seen any higher incidents of the students or teachers having COVID compared to the other school, the public schools that have been opened with their, part-time open, part-time online hybrid system?
Yeah, we have had a number of clusters associated, and I think, and I don't want to say that it's because they're private or public. I think it has to do with the restrictions or the precautions that they've taken. But in one school in particular, and I will not name their name because I don't think that's fair. They did not have 6 feet distancing, and they did not use masks consistently, and we had clusters in that school. Now, it's hard to say whether it was the less than 6 feet or the absence of masks that led to that, but there was clearly concerns in that particular building. So I do believe that these mitigation strategies are helpful. I do think that masks are more important than distancing, I'll tell you that.
Just to go back on this rate that we say we'd like to get down to in order to open up the schools safely under CDC guidelines, which you referenced. That is a percentage of tests per 1,000 people in your community that you referenced that we're not down to. That's correct. Yes.
It's new cases per 100,000 in the last 7 days.
Okay. Does anywhere in that matrix, does it take into effect that maybe different counties test a higher percentage of the population than other counties? Through you, Madam Chairman.
So that's factored into the second metric, which is your positivity rate. So if you're, they kind of counteract. If you're under testing and you don't find very many cases, your rate will be high. If you're over testing, you'll have a lower new cases per 100,000, but your positivity rate will be low. So the 2 metrics sort of work hand in hand to try to present a balanced assessment of the risk in a particular community. Yes, there are always, there are always going to be, nuances to the test data, but I think those 2 metrics are as good as any that I've seen to give a good sense of where a community is.
Okay. Through you, Madam Chairman, the one test, which is a PSR test, which is a test that looks for the virus in the nose versus a quick test. You said that one test its positivity rate is a lot longer, even if the person is not contagious. Is that correct for you, Madam Chairman?
That is true of the PCR test, yes.
And so if somebody had a positive test that, and then they came back and did a quick test, what we call the quick test, through you, Madam Chairman, and they were negative, is it safe to say that they've been had the disease for a longer period of time and now they are safe to go about non-restrictive restrictions?
So that's why this state health department has issued return to school guidelines for, if we're talking about schools. And so with a doctor's note in somebody who's recovering from COVID, we will allow them to go back to school at 10 days following the date of their positive test or date of symptom onset, whichever comes first. So we don't look to retesting PCR tests in those individuals because it is presumed to be persistently positive. But we know that at 10 days, the chance of them being infectious is exceedingly low. And so we allow them to go back to school as long as they're symptom free and it's been 10 days.
Just one or two more questions here to you, Madam Chairman. How many kids under the age of 18 have died in Monroe County?
I'd have to look at my data, but very, very few.
Okay, thank you. I guess I'll leave my time back to the chairman, and thank you for your time.
Madam Chair,
Legislator Elcock.
Legislator Boyce.
Legislator Boyce, you have the floor.
Thank you, Madam Chair. Dr. Mendoza, do you serve in the capacity or on the board of directors for the Association of County Health Officials?
Yes, I do.
And are you aware of any statements that that board has made with regards to reopening schools?
I'm not, statements to whom? We're looking for the same thing everybody else is looking for. We're looking for clear guidance from the state to help schools to reopen. We have issued a number of communications to the governor's office. I don't have those in front of me, but yes, we're in direct communication with the governor's office and the state health department. So
would you say that those statements that you've made to the New York State or to the governor's office, are they in favor or lobbying in favor of opening schools?
I don't think they've been lobbying for or against. I think, we're lobbying. We want schools to open too, but we want to do so safely. I think the debate is around what is safe and how do we balance safety from COVID with safety from other things. So, we're not unilaterally trying to reopen schools at all costs. No, I think we want what everybody else wants, which is our kids to be healthy and safe from COVID and from everything else. So that is sort of our position, but we're not, lobbying to open up schools at all costs.
Yes. So so I have to, I'm looking at this and I'm going, okay, there's the New York State Department of Health, there's the County Department of Health. So can you tell the layperson what's the difference? Because my understanding is that in your capacity as the county health director, you're also an employee of the New York State Department of Health.
I get my paycheck from the County of Monroe. So my understanding is I'm appointed by the county executive, approved by this body. And then I think there is some approval that happens at the state, but I'm not employed by the state health department.
Okay, so there's no linkage between your capacity. Okay. I think some of my fellow legislators have asked about, the mental health, that it's, effect on the children. And so the CDC has reported that about 31% increase in proportion of mental health related emergency room presentation in children across the US, and beginning with the COVID school closures. Do you have statistical data with regards to the suicide rate among children 18 and under at this point for Monroe County?
Thankfully, it's a rare event, so we don't have a lot of numbers. I'm not aware of a suicide attributable to COVID in Monroe County, but that's not to say that it's not a problem. I am aware. I think we're seeing nationally an increase in suicide attempts. And I think, it's hard to blame anything but COVID for that and the restrictions that have been placed, as a result of it. But I'm not aware of any here in Monroe County, knock on wood. And, but, it's, people put out sort of, COVID versus suicide as though it's some kind of a choice. We want to eliminate both. Right. And so we're trying to balance the risk, and nobody's been through this before. And that's the challenge with this. We want our kids to be mentally well, and we want them to go back to school if that's what it means, but we want to do so safely. We do not know about the long-term effects of COVID-19 on kids. And I will be the last person to want to take a chance that I don't think is necessary on the expense of our children.
Thank you. And I appreciate you being here this evening to answer the questions of the legislature. Certainly, being a parent of 3 children, but they are older, they've graduated, but certainly I really feel for the children and their parents that are dealing with this at this point. So I'll yield the floor. Thank you so much.
Legislator Udelson.
Legislator Elkofer.
Legislator Udelson.
Thank you, Madam Chair. I'll be quick. I just want to first say that I'm pleased to be participating in this tonight because we all share the same goal of getting the kids back to school, which is so important, but wanting to do it in a manner that's safest for the kids, the teachers, and the staff. And I would just like to, through the chair, ask Dr. Mendoza if there was in the past week any new guidelines issued by the states regarding school reopening.
By the state? I'm not aware of anything issued new from the state health department, no.
Yeah, my understanding is, it's been pretty much the same and left up to the school. So in the 2 weeks since this meeting was called, or in the couple of weeks before that, to your knowledge, nothing has changed, right?
No, if I see anything, trust me, I will be the first to read it and present it as best I can to the public.
Yeah. So for quite a while now, then the schools and the school boards and superintendents have had the authority and the ability to decide whether to open school or not open school, or this hybrid model that several of them have accepted or adopted for the time being, and obviously subject to the approval of the state education department. So just to reiterate what has been asked and answered, when they do that, there is no approval given or authority to be given by you as health commissioner, correct?
Nope.
And there is no approval by the county executive.
Nope.
Okay. So I guess I just wanted to also say that I was actually glad for the earlier comments of Legislator Baines and Legislator DeFlorio. Legislator DeFlorio pointed out that there is a lot of confusion about what can be done and what can't be done. And her questions to you just kind of amplified your answers to Legislator Baines, that it is, as we just covered, in fact, not your decision. Your authority is in other areas, and that is up to these school boards and superintendents. And, so we obviously wish them well, and that they are receiving good counsel and making the right decisions for our kids. I yield back. Thank you, ma'am.
Legislator Elkofer.
Yes, thank you so much, Madam Chair. Welcome, Dr. Mendoza, and thank you for taking my questions here. I've got one question, and I've got 3 from residents of the town of Gates that have contacted me. My question: on March 16th, 2020, schools were closed by an executive order, and they were closed by no later than March 18th, 2020. At any time since you directed or ordered any schools in Monroe County to take safety precautions or restrictions to prevent the spread of COVID-19, were they in excess of the mandate by the state of New York?
I give recommendations to the school districts and to the schools. Are they in excess?
Were they in excess?
So
the mandates coming down from the state.
Right. So one example might be plexiglass barriers. The state health department guidelines permit them, but the scientific evidence, as I read it in the fall, was really not very strong in favor of these plexiglass barriers. And most of what I had read was that plexiglass barriers do not substitute for 6-foot distance. So I think the schools decided that they would go with 6-foot distance.
Okay, thank you. Now these next 3 questions are from residents of the town of Gates that contacted me. Number 1, were there in-school or after-school activities that were restricted in excess of the mandated state guidelines? club activities, assemblies, after-school events, internship, or mentor programs?
Those are all at the discretion of the school district.
Okay, so they are at the discretion of the school district then. Okay. Next question. Due to the virus and schools being closed, what provisions are being taken between the school districts and the health department to ensure a student's mental and physical needs are being addressed and recorded?
In terms of being addressed, I think we can all agree that our schools care very much about mental health of their students. Speaking from my own experience with my district, the counselors have made themselves very available. They've said, they've conducted sort of virtual meetings, support groups and so forth. So I do think that there's a lot being done in that regard. As far as reporting, we've never done a great job reporting on mental illnesses in school settings. I think we in healthcare do maybe a little bit better job. But this is an area that I think we need to work on. We don't have good epidemiology on the mental health of adolescents in general, outside of healthcare.
Okay, thank you. Through the
Legislator,
chair.
Yep.
I got
That's
one
all. I
other
was just
question.
gonna, yeah,
Madam
you're fine.
Chair.
I just was gonna remind all legislators to make sure that they're directing all questions through the chair. So thank
Through
you,
the chair.
Legislator Alcalfer.
Okay, through the chair. In addition to school counselors, will Monroe County Health Department personnel be available for school districts to discuss the specific needs of students who may need extended specialized care?
Can you be more specific about extended specialized?
Sure. I'm thinking of in the town of Gates, I have an autism program that deals with autistic children, and we really have the program at Roberts Wesleyan College here. But I'm just wondering about what care, I guess, that we can give people with autism in our community, specialized care.
Right. This is an area where in the health department, we don't have, specialists in autism per se. We work with our counterparts at the Golisano Children's Hospital and across the community and not-for-profits and community-based organizations to provide support for those individuals. We work through Department of Human Services and OPWDD as appropriate. But our primary job is to hopefully detect and then refer to the next step of care.
Okay. Where would those, through the chair, where would those students, parents go to get that specialized care away from the school districts?
I would imagine they would start with their primary care provider or therapist if they have one. Going through the schools, I think the school counselors is an approach. We welcome people calling us if they have questions, and we can help point them in the right direction to resources in the community. What we don't want is people to not reach out.
Okay, thank you. Madam Chair, I yield the floor.
Thank you.
Legislator Wilt.
Legislator Wilt, you have the floor.
Thank you, Madam Chair. Dr. Mendoza, I'd like to just follow up a little bit on Legislator Boyce's talk to you about suicide. Do you have any data at all how children's suicide rates have changed since COVID-19?
I don't have those data in front of me now.
Okay, so you do feel it's important to public health for this information, don't you?
Absolutely. No, and before COVID began, one of my goals in, the beginning of 2020 was to implement in the schools an early intervention program for acute mental illness. One of the things that I had heard, and this is dating back to 2019, one of the things I'd heard very consistently from school counselors was that they hear these, what we call red flag or pink flags symptoms, if you will, from the students, and that the superintendents and the counselors don't know what to do with that information. So, we want to prevent suicide very much like we want to prevent opioid overdoses. But if all we do is try to prevent the last event, then we're really going to miss a lot of opportunities. And so I had hoped, in the same way that I've approached the opioid crisis, to identify risk factors further upstream. And so my hope when COVID is all over, that we'll go back to looking into all of those ways that we can better detect those early warning signs in the schools. Because I know as a primary care doctor that I don't get a lot of adolescents coming to my clinic to see me to talk about their mental health concerns. We know that adolescents don't access primary care in the same rates that younger kids or older adults do. I've used schools and community partners really as the barometer on how our adolescents are doing, and we need to do a better job of that. And I think here in the health department, we can help by providing epidemiology and surveillance and, all the things that we can do to prevent in the same way that we're approaching the opioid crisis. We don't want to wait until an overdose to do something. We don't want to wait until a suicide to do something. So, when this is all over, I do want to get back to that work.
Okay, thank you. And I yield the,
Oh, sorry.
I yield the floor.
Legislator Baines, please, Madam Chairwoman.
Yep, so hold on just one second. I just wanted to check, are there any other legislators out there that have not had a chance to have the floor to ask Dr. Mendoza a question before we circle back? Okay, we will go to Legislator Baines and then Legislator DeFlorio, because I believe both have spoke up to speak again. So Legislator Baines.
Thank you, Madam Chairwoman. A reference was made by Legislator DeFlorio to the fact that I might be somewhat confused about the situation. And I just want to be clear that this is the work I've done for 45 years. I'm very aware of how the education system works. And I was involved in its governance for many, many years. So for instance, the superintendent of schools of any superintendency in the state is certified by the state of New York Education Department. A school board, if it violates school state policy, can be vacated. They can remove the school board members. And I want to assure all of you that there is no role whatsoever in terms of whether these schools are open or not relative to any local Department of Health, any more than it would be our role to tell the highway superintendent in Webster when the truck should roll or when they shouldn't roll during a snowstorm. So Dr. Mendoza, through the chair to you, question for you, Dr. Mendoza, through the chair. Dr. Mendoza, reports are that 500,000 Americans have died from COVID. Do you accept that data as fact?
I think it's probably an underestimate of the true death toll from COVID. There is this, myth that somehow we've changed how we diagnose death in the era of COVID. And we have not. The field of forensic pathology and of pronouncing death has not changed in the last 2 years. And most experts believe that we're underestimating. When you look at excess death data, there have been an excess of deaths in 2020, and there is no other good explanation for it other than the COVID-19 pandemic.
Through you, Madam Chairwoman, to Dr. Mendoza. The CDC guidelines, which have dominated all of these decisions, and by all of the local municipalities, which school districts are local municipalities, they were promulgated during the Trump administration, were they not?
Last year, that's when they all came out. That's when the pandemic started, yes.
And they haven't changed under the Biden administration, have they?
What are you referring to specifically?
I'm talking about the CDC guidelines as they relate to recommending the conduct of school or other public entities in terms of conducting business.
The guidelines came out on February 12th. There were guidelines from the CDC that were issued in September, but that was earlier in the pandemic. The most recent guidelines have probably the most specific path toward reopening, but I don't think the CDC was in a position to make those recommendations so early in the pandemic, looking ahead to what we had all anticipated would be a surge in the wintertime. But I think now that we're on this sort of downward slope, the main variable outstanding are these COVID variants. Mostly it's just unknown. I don't really have any reason to believe that the vaccine is not going to work. In fact, I think there's good evidence that the vaccines will work against these variants. There is also good reason to believe that all of the mitigation steps that we're undertaking now will work with the new variants, even though they may be more contagious. As far as whether the guidance came out of the Trump or the Biden, my job as a physician and as a scientist is I look at the guidance as it comes out, and I look at the merits of the science, and I honestly don't pay attention to who's in office.
Well, through you, Madam Chairwoman, and a comment, I suppose, and then Dr. Mendoza, if you'd like to comment. Legislator Hebert said, even you, Legislator Baines, may think that face-to-face instruction is superior. Well, I've been delivering it every single day. I've been in the classroom with young people who are masked. I haven't missed a day of school. I'm a 67-year-old cancer survivor with mild hypertension. I have comorbidities, and I have not missed a day. So this idea that we don't want to open the schools, or that I don't, or anybody else, I absolutely am desperate to open them. That's why I'm still a teacher. And I would suggest that if we have a hearing, if we want to have these hearings, and by the way, thank you, Dr. Mendoza, for your frank comments. I'd like to see us have some of the actual policymakers come in. So let's bring in some school superintendents, many of whom are making over $200,000 a year. They're appointed by their elected school boards. Let's bring in some presidents of some school boards and ask them why they're making the decisions they're making. And let's stop the political games. I yield my time.
Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. And just to respond to that comment from Legislator Baines, and I appreciate that suggestion. Until this evening, there was a lot of confusion. You may know, you may have worked in education for however many years you said you've worked in education. The rest of us do not. We were getting questions from our constituents, which is why we called this meeting, to get clarity. So thank you. And thank you, Dr. Mendoza, for being here and providing that clarity. I want to circle back through the chair to you, Dr. Mendoza. I want to make sure I understood you correctly. You indicated, I believe, that the state said that it was okay or within their guidelines to utilize plexiglass as an alternative barrier, but that the schools decided not to go that route. Is that what I think I heard you say?
I assume that they went that route because they're not using plexiglass barriers. I think if they had proposed that and chose to go that path, they could have done that. But again, this is entirely the schools following their own plans as approved by the state.
Yeah, I just wanted to make sure I understood you. So within the state guidelines, schools can utilize the plexiglass barriers. You're just not convinced that they're effective, correct?
That's correct.
Okay, thank you. Just wanted to make sure I was clear.
Mm-hmm.
And one other point that I want to get back to just briefly, and I know that you, as well as a lot of other people, and not that I'm disagreeing with the statement, but we keep saying that we want to make sure that it's safe to get back to school. So we keep talking about it being safe. And so obviously one of the issues is to define safe. And we've talked a lot about that tonight. But one thing I feel like we keep neglecting to talk about is, when is it not safe to not be in school? And I know that we've talked about mental health issues, but I'm also wondering about I'm assuming, decline in CPS referrals, nutritional health, perhaps siblings watching siblings because their parents are working, all of those things that school provides, that safe environment for a lot of things that are going on across our community. And there are a lot of children that now don't have that safety net of school to depend on. And I'm concerned that we're missing that piece of it, and that we're not looking at the big picture, and we're looking at COVID. And I'm not trying to say that COVID's not important. Got family health issues. We've been mission critical trying to keep our families safe throughout this. So I absolutely am not trying to minimize this at all, but I remain troubled that we're not addressing some of these other things going on in our community.
Well, I think you've hit on the question of this generation. I 100% agree that mental health concerns were important before COVID, and they're even more important now. We don't have a magic formula to weigh, what gives you 3 points of risk from COVID versus 3 points of risk from mental health. We just don't have that kind of science. We don't have that kind of experience. part of this being a novel pandemic is that we are learning as we go. And I think it's through conversation and looking at the science and getting information from reliable sources and having these conversations is what's going to get us through this. You know, it's apples and oranges, and they're both really important. You know, you know, I look to the CDC guidance because it's not just, you know, infectious disease experts looking at this, but they've got, you know, mental health experts and others looking at this, and this is the guidance that they've created through evidence at the time of when it was released, and it will probably change. But you know, we don't have any real authorities that are looking at the entire thing, and I think public health, if anybody, is trying to do that. You know, if you look at mental health associations, obviously they're going to advocate for mental health, as they should, rightfully so. But you know, American Academy of Pediatrics, they're looking out for the health of children. That's their job. But there isn't, you know, when it's something this complicated, there isn't a single body that is going to weigh every piece of evidence across the, you know, entire, you know, board. And so that's where public health is trying to do our best in this time of crisis. And I absolutely appreciate that mental health is key to all of this.
Thank you.
Legislator
I yield my time.
Madam
Alcoffer?
Chair, Robert.
Legislator Ellicoffer, you have the floor.
Yes. Thank you, Madam Chair. I wanted to respond to Legislator Bain's comment here. Again, I'm not an educator. I'm not a teacher or a board member, but I came to tonight's meeting to learn more about COVID and the impact it has on our schools, the closing of them, the reopening of them. So this was a very informative meeting tonight. It educated me because there's so many innuendos out there floating on a day-to-day basis about school closing, school reopenings, what the mandates are. So Dr. Mendoza, thank you for educating at least me, and I appreciate that.
Legislator Colby.
Legislator Colby, you have the floor.
Thank you, Madam Chairman. Through you, Madam Chairman, just want to clarify, Dr. Mendoza, so with the school administration or school superintendents more specifically, you have just been an advising role with them if they should do something or not do something as far as what level of schools they should have open and what type of activities are permissible in their schools. Is that correct?
You know, I don't know that I don't like trying to tell them what to do. I, as a doctor, with my patients, I try to provide information, and my patients make decisions based on what I hope is both sound information and sound reasoning. I don't tell my patients to take their medicines. I try to help them understand why it's important to take their medicines and what happens if they don't. And I take that approach with whenever I give guidance or advice or recommendations or whatever you call it. I don't regulate the schools. So short of that, I want to give them accurate information based on my best read of the science. And I try to go through the reasoning for it because I think superintendents and school boards are intelligent people who understand schools far better than I do. And I want them to make the best decision for them, given the particulars of every community in this county, which is different from one another. You know, I think different counties and different districts will have different needs and different abilities to implement whatever they implement. And that's why it makes sense for them to create a plan and stick to it. And I will say that based on what I've observed, they are sticking very close to these plans because they want to do the right thing. And they are, just like everybody else, navigating a lot of uncertainty. So, you know, I don't ever think of myself as wanting to tell people what to do. That's just not my general approach as a doctor.
Thank you. Through you, Madam Chair, though, I didn't say you were telling them. I said you were advising them, but you refer to their plans. I find it astounding that why haven't you taken the time to ask them or review any of their plans that if you had a patient in front of you, wouldn't you want to know all the data about that patient, all the tests and what they're taking? Why wouldn't you want to look at their plans to see if they're on the right tracks or not? I find it amazing that you haven't looked at any of the plans at this time.
Well, as a doctor, I'm an expert in health, and I'm not an expert in schools. So I don't think it makes sense for me to review school plans because I have no basis for evaluating those school plans.
Yeah,
but the first thing about how to implement a classroom or how to do instruction. I think that's a school, I give advice on the pieces that I have expertise in, which is the
But
clinical
there's-
part and the public health
but-
part.
Through the Madam Chairman, but there's pieces in there such as masking, 6-foot distancing versus 3-foot, using plexiglass or not plexiglass in those situations. So when those components of the plan, you would be able to give them sound advice on which way you think would be better. So I would have thought that looking at the plans and giving advice or critiquing those portions of plans would have been appropriate for you to do.
I don't think so. I have a sense of what they're thinking as to the questions that they ask. And I take any questions that they ask and I answer to the best of my ability. But I don't know the particulars of Churchville High School District. I don't know what it looks like in their, in their auditorium. I have no way of evaluating any of these specific plans.
And just one final question. So just to make it clear, the CDC talks about plexiglass as an effective method. And from your opinion, and just your opinion, plexiglass is not, your understanding or your opinion is plexiglass is not a very effective way to prevent the spread.
Plexiglass does not appear anywhere in the most recent CDC guidelines.
Doesn't barriers appear between any plans for you, Madam Chairman?
I'll have to look again, but I don't believe so.
They do.
Okay, I'll have to look too. Thank you. I'll leave the floor back to the chairman.
Oh, one correction. It does, so plexiglass does appear with regard to temporary interaction. So I think there's a reference to like bank tellers or grocery stores. There is a statement in one of the guidelines, and I'm not sure it's in the school one, but they will talk about plexiglass barriers for temporary face-to-face interactions that are less than 6 feet. But I think we can all agree that in a classroom, those are not temporary interactions. And that gets to the difference between sort of the projectile respiratory droplets that happen when you cough or sneeze, as opposed to the droplets that are aerosolized in a room because of breathing. And so the science around plexiglass is sort of nuanced there. We know that that COVID is aerosolized and it floats in the air. And, unless you're entirely encapsulated in plexiglass, which creates a different problem, that of ventilation and not being able to ventilate, that's why plexiglass is useful in grocery stores and in banks and in, checkout counters when you have a brief interaction. But most of the science that I've read is that plexiglass does not change the flow of aerosolized respiratory droplets.
Madam Chairman, I'm sorry, but that brings up another question, just for my own curiosity. How long have you read anywhere through Madam Chairman to Dr. Mendoza? How long does the particles stay airborne where they could still come in contact with somebody? Is it a 12-hour, 5-hour, 30 hours, 40 hours?
It depends on the ventilation and the airflow in a room. And so, there are scientists. There's one scientist out of the University of Colorado who's done a lot of experiments and looking at, the flow. I'd have to refer to his papers on that. But, if there is no, in an area that is got low ventilation, we know that the droplets will fall to the ground, within 6 feet within a matter of minutes, 15 minutes. But when there is ventilation, you need that because you want to circulate the air. And when you've got people walking around and breathing, there will inherently be ventilation and movement of air. It does take longer, but we tell any schools or businesses, if you wait, if a person who was infected with COVID was in a particular room, and you evacuate that space and leave it dormant for 24 hours, that room is perfectly safe to go back into with routine cleaning. So it is not suspended in the air for more than 24 hours, even in those kinds of circumstances.
One more question. Now you got me going. Through you, Madam Chairman, Mendoza. There's a lot of talk about like playing instruments, wind instruments, or singing.
Mm-hmm.
How much farther does like singing forces the particles or the to flow versus beyond the 6 foot versus regular talking?
12
Through you,
feet.
Madam Chairman.
So the guidelines indicate 12 feet. Now, obviously, it probably differs based on the kind of instrument, you know. But 12 feet is the guideline, and choral, you know, singing is probably more risky than even playing a band instrument. And then obviously piano and strings have no risk. So.
Thank you, Madam Chairman. I'll finally yield the floor.
Legislator Hebert.
Legislator Hebert, you have the floor.
Thank you. I just have one quick question for you, Dr. Mendoza. Through you, Madam Chair. In your opinion, Doctor, do the New York State Education Department school rules, the reopening rules, adhere to the CDC's guidance as it was modified on February 12th of this year?
The New York State Education Guidelines, I think, were the 87-page document that was issued in the summertime.
Right.
I did not read that cover to cover. I read the State Health Department guidelines cover to cover. But I don't know to what extent that's congruent with the CDC guidelines from 2 weeks ago.
Okay, good correction, and thank you. You are correct. Follow-on question through you, Madam Chair, to Dr. Mendoza. The two organizations you just mentioned, both the Education Department and Department of Health, if you saw there were differences between the CDC's February 12th guidance and that, would you be advocating with anyone for changes?
I would advocate for changes to that. Yeah, I would want the guidelines that are implemented in our jurisdiction, be it Monroe County or the state of New York, to be consistent with the latest, guidelines from the CDC. Absolutely.
Okay. I hate to circle back to this question, but the question is, if that's the case, the CDC says sports should be opened after schools. Why did you approve it? Through the chair.
Well, the CDC guidelines weren't out when we approved sports before schools.
Through the chair, will you be rescinding that guideline?
No, I don't think so, because I think now we have experience with contact tracing in sports. So I think we've learned, and it has not come without without some risk. We've had evidence of transmission within teams. Hard to know if that's more or less than the baseline rate in an age-matched population. But we're not seeing evidence of on-court or on-field, even in indoor sports. Wrestling, we were very concerned for obvious reasons, and we haven't seen any evidence of transmission between wrestlers who are competing. We're looking, we're not finding, which is good news. But no, I don't think we have good reason to rescind that at all.
Thank you. I yield the floor, Madam Chair.
Legislator DeFlorio.
Legislator DeFlorio, you have the floor.
Thank you. This is great conversation, very, very helpful to get some of these questions answered. Just to circle back, and I know you didn't write the guidelines, but I guess I'm just curious. We keep talking about low transmission, low spread within school settings and within children, be it, basketball players on the court, wrestlers on the mat. And I guess I'm just wondering, when we talk about the number of positive cases and the thresholds that we have to get to, why there isn't a differentiation made between the number of positive cases within a school setting versus the community at large. If the spread isn't happening inside the school, why are the schools being held to the same standards or rate benchmarks that the community as a whole is being held to?
So the rates in the schools are almost universally lower than the corresponding rate in the community at that time, but they rise and flow together. So the rate of positive kids in schools is higher when the rate is higher among the adults out of school. We don't have good evidence of in-school transmission, and I think that's because of the precautions that our schools have taken. But if you look back to the numbers in December and November, there were a lot of kids who were in school at the time who were positive, and they were excluded from school and the whole bit. But the rate in schools is lower than it is in the community at large, but they rise and fall, together.
I guess my question, though, through the chair to you, Dr. Mendoza, is even when we were finding those cases in school, and I know where I work, we get reported number of cases, but every time I've gotten an email from school or from work, there's been a clear indication that the person didn't get it at school or at work. So the spread isn't happening in those environments. So again, I just feel like those school, for lack of a better statement, is being punished for the behavior of the community. Or the, just not even behavior, but transmission rate within the community.
I hear you. No, I think it's a valid point. But, you know, we don't want outbreaks to happen in the schools, and we want to do everything we can to keep those kids who have the infection and are in contagious out of the schools. Is it punishing the schools? You know, it's just the fact. I mean, we've had to exclude these students, but again, this isn't a scientific trial here. We're observing as we go. We don't know what it would have looked like had we had full in-person school with no distancing at all. We just don't know, because we didn't try that here. And would it have had a different outcome? I don't know, probably. But again, this is based on the best available evidence that we had at the time back in August. And now we have 6 more months of experience, and hopefully we've learned something.
Are we consistently, through the chair, are we consistently looking at the data from, let's say, states or countries that have fully implemented reopening of their schools? I know there are places around the globe where people are going to school full time. So I'm just wondering, has that data been examined, and can we learn from it? Because again, we can all agree, one of the reasons that we're here is because we're hearing from so many people that they want their kids back in school full time for a myriad of reasons.
Right. And I can't pretend to claim to know all of the science. There is so much that's published. I look to, reputable sources like the CDC. Ultimately, the state health department is also a public health agency, and they have to change the guidelines in order for it to matter. So, we do the best we can to advocate for science, and we're on weekly calls with the state health department, if not twice weekly. But ultimately, they need to change the guidelines if they see a need to do so. I don't think the latest CDC guidelines are all that different from what the state health department released back in August, with the exception of the pathway toward reopening with the transmission rate and the positivity rate and so forth spelled out. That's the one new, contribution that the CDC guidelines have put forward. But masking, social distancing, sanitation, and all the other, mitigation strategies are largely unchanged.
So one last question, I promise. I know that you've said that barriers don't necessarily work in a situation like a school or a room where people are sitting for long periods of time based on ventilation, et cetera. And I guess I'm just wondering, have you seen within the county anyways, transmission rates in offices, say the county office building, for instance, where people are sitting in, for lack of a better, cube farms, where they're probably not 6 feet away, but the only thing between them and their next desk mate is a barrier.
Yes, we have definitely seen that. Call centers, office settings, cubicle areas. Yes, definitely. And it's like wildfire in rooms like that. Yeah.
Thank you. I yield the floor.
Mm-hmm.
Legislator Hebert, one really quick question, if I could.
Legislator Hebert, you have the floor.
Thank you, ma'am. Dr. Mendoza, through the chair, your answer to my question about extracurricular sports and stuff got me thinking. And if contact tracing is showing that disease is not spreading through contact sports, which the CDC says is the worst thing, and I think we would all agree, wrestling, when I was a wrestler in high school, we talk about head next to head, right? If disease isn't spreading that way, why can't that be used as a reason schools could reopen? Because anything short of wrestling is much better and has much lower chances of spread. I guess I'm just confused. Please
I hear you. No, I mean, the way I look at it is that wrestling and classrooms are different. Airflow is probably different. Wrestling happens in a gym or a large room. There may be fewer people. A wrestling match is not all day long. There's 5 minutes, 10 minutes. I don't know how long the matches are, but they're a brief period of time. It's obviously very close. but it's not going to be the prolonged breathing, talking like you would in the classroom. They're very different. Whether one is higher or lower than the other remains to be seen. But I don't think that you can say that just because it's quote safe in wrestling that it must be safe in classrooms, and you can't say the converse either. I think they're inherently different activities.
Thank you. I yield the floor.
Legislator
Madam Chairman,
Alcoffer.
Legislator Alcoffer, you have the floor.
Thank you, Madam Chair. Through you to Dr. Mendoza. Dr. Mendoza, we're here at the end of February, and it's about that time where for school sports, wrestling, it's the sectionals, it's the states, girls volleyball, basketball, so forth. What are the protocols for teams from different parts of the states traveling to other parts of the states for competition? Are there any protocols or anything like that from a red zone or an orange zone or yellow zone, anything like that?
Yes, there are guidelines that are in place. Again, those were put forward by the State Health Department in conjunction with NISFA. They have their guidelines as well. And very analogous to schools, we are advisory at most, but what matters is the State Health Department rules and their consultation with NISFA.
Okay, thank you.
Madam Chairman, Robert Colby.
Legislator Colby, you have the floor.
Thank you. I'm still thinking about this airflow issue through you, Madam Chairman, to Mendoza. So in a room that has low airflow and just sits idle, we have the particles dissipate quicker than when we have a lot of disturbance or current in the airflow. Is that what you were saying through you, Madam Chairman?
Yeah, that's my understanding of aerosolized versus droplets, yes.
And so when they're talking about not good enough ventilation in some of these school classrooms, more ventilation would be poorer because it would spread the aerosols around more or less.
I mean, that's one of those areas that I'm not an expert in. We can start by saying outdoors is essentially entirely safe. It is very hard to contract COVID outside unless you're face to face with somebody for a prolonged period of time. And we saw that outdoors last summer. But indoors, the variables are, many. And again, I'm not an expert in airflow. But we do know that, you stack the odds in your favor if you have distance, that you wear a mask, then that adds more protection. But as to the comparison between 3 feet versus a certain type of HVAC system, those are questions that I don't know the answer to.
Thank you. I'll yield the floor back to you, Madam Chairman.
Legislator Alcoffer calling.
Legislator Alcoffer, you have the floor.
I do have one more question to Dr. Mendoza through you, Madam Chair. Regarding vaccinations in Monroe County here, I recently got my second vaccine at the VA, and it just, I can't say enough about the VA, how organized they were. Both times in and out within, say, 40 minutes. Wonderful. Where are we now with vaccinations throughout Monroe County? What age group are we? Are we dealing with the 60 and older or 65 and older for their first or second shots?
So I'd have to look at the data, but the vaccine tracker, last I looked maybe a couple of days ago, is that we were up to 13% of the population in New York State. I'd have to look, and it varies obviously by demographic and so forth, but the eligible population at this point are the 1A and 1B eligible employees. So that's healthcare, long-term care residents and staff, OPWDD residents and staff. The 1B essential employees is a long list. Notable among them are teachers, first responders, paramedics. The list is relatively long. And more recently, we've added 65 and older. So anybody 65 and older, regardless of their medical condition. And then most recently, it was adults 18 and older with any of the longer list of medical comorbidities. So that is the universe of people who is eligible for vaccine at this time.
Gotcha. Through you, Madam Chair, Dr. Mendoza, when do you see the basically all the residents of Monroe County vaccinated by the end of this year or early next year?
This is one of those, I wish I had a crystal ball kinds of questions.
Sure.
It really all depends on how quickly the vaccine comes to New York State. We are getting rid of all of it within a week of it getting here. By getting rid of it, I mean administering it to people who are eligible. Depending on who you listen to and what you read, one thing that is pretty sure is that we're not going to see kids getting vaccinated until late summer is sort of the working estimation. I think, I've heard Dr. Fauci say that we'll get, most adults by April or May, which I think is optimistic. But my hope is that going into next year, we'll have a relatively normal year with the exception of masks in schools. I'd like to see the vaccine rate high enough that we'll have a rate low enough in the community that using these CDC guidelines that we won't need to have social distancing in schools. I do think that masks are going to be a reality for some time. I would be very surprised if the masking recommendations went away this calendar year. But I'm hopeful that come next academic year, we'll be looking at a much more normal academic year.
Gotcha. Thank you.
Mm-hmm.
Thank you, Dr. Mendoza, for answering those questions around the vaccines. I know they were outside the scope of focusing on the schools, so I do appreciate you answering those. For any legislators going forward, I think we should stay to the topic that we asked Dr. Mendoza to be here for. Are there any other legislators that have any other questions for Dr. Mendoza?
Legislator DeFlorio?
I'm sorry, Legislator Baines, is that who I heard?
Yes.
And Legislator DeFlorio also next.
Yeah. So we'll do the Legislator Baines and then Legislator DeFlorio. Thank you. Legislator Baines, you have the floor.
Through you, Mr. Chair, to Dr. Mendoza. Dr. Mendoza, it's my observation that returning sports has been one of the strongest moves we've made to support the mental health of the young women with whom I work at Our Lady of Mercy and worked with for all of my career. Do you think that the return of sports provides students with a support for their mental health in terms of being with their teammates and just a physical activity?
I think so, but it's not the same as what we would normally expect sports to provide. We tell our athletes, and I tell my daughter who's an athlete, wear your mask on the field, wear your mask on the sidelines, and you can't hang out with your teammates like you normally do. We're used to having pasta parties on the nights before games, and we don't do that. So is it helping? Yes. Is it normal? No. But it is a step in the right direction. And to your point, I think anything that we can do that is promoting that social connection safely. I mean, playing the sport itself is social connection, but it's not the same as it was before. There's no question, but it is a step in the right direction. I agree with that.
Through you, Madam Chairwoman. Dr. Mendoza, I'm really excited to hear you talk about mental health as a focus that you'd like to return to. And I would urge you, if you haven't done so already, to examine the extent to which local school districts have increased their funding of mental health services. And this is particularly true of psychologists, social workers, drug and alcohol prevention experts. In fact, are you aware of the program at the Fairport schools where they actually have Strong Health as a partner and Strong Health has an office right into the Fairport schools so that there's a seamless availability and presentation of mental health services to young people? Are you aware of that, Dr. Mendoza?
I wasn't aware of the specifics, but I was aware of the general idea. I mean, I think schools and libraries really ought to be the next frontier for public health. It's a way for us to get into the communities where traditional healthcare isn't present in the same way. I think the health department has potentially a huge role in community centers, rec centers, libraries, the sort of places where kids go more often.
Through you, Madam Chairwoman, when I was a local judge, I felt like we were running a mental health seminar for the young people in my community who were in court for the 10 years that I served. So I would agree with that idea of the presence of mental health services throughout the continuum, particularly in the most at-risk environments. So just as a closing to the hearing, I apologize if I'm cranky because I'm in the field. I feel like the work is so important. It's my life's work. And I feel like anybody who politicizes students or young people, maybe people aren't. And I want to apologize if I offended anybody, but on the other hand, it feels to me like a lot of people are trying to take advantage of this situation, take shots. And I would say that Dr. Mendoza, you're a classic example of how a public servant shows up and takes the heat and responds in a professional way. Extremely impressed, and I want to thank you immensely for your long and service for our county, and your tough-minded and sensitive response to these questions. I yield.
Legislator DeFlorio, you have the floor.
Yes, thank you. Through the chair to Dr. Mendoza, just a follow-up question with regard to vaccines as they pertain to schools. So you mentioned something about children being vaccinated, and I know that there has been a significant amount of concern that at least has been communicated to me that parents are worried that there's going to be required vaccination requirements for students to go to school. So and I know that there's a lot of parents on the line listening tonight. So could you please clarify your thoughts around that and anything that perhaps you know with regard to school-age children being vaccinated?
So as you all know, the approval process for this vaccine was different than the traditional approval process with FDA. So these vaccines are being made available through emergency use authorization, or EUA. And EUAs are such that they're essentially accelerating the approval process so that these products can go to market more quickly in the setting of a pandemic, a public health crisis. So the studies so far have enrolled adults, 18 and older or 16 and older, depending on the product. But the trials for, I think now 12 and up are ongoing. And so it will take some time to wrap those up. This is typical for any kind of medical, product. They'll investigate, in general, older adults and then sort of progress down into the younger populations. But as to whether it's going to be required or not, it cannot be required unless it's fully FDA approved. I don't know the details of how that process will unfold. But right now, we're encouraging everybody who is eligible to get the vaccine because it's effective. It prevents death. It virtually wipes out hospitalization rates, and we think that it decreases transmission. The goal, I hope, in the very near future, is that people who are vaccinated can stop using their masks when they're in the company of other people who are vaccinated. And as the number of people in our community who are vaccinated increases, we will slowly start to see some more signs of normalcy. When masks are completely, no longer recommended, like I said, it'll take some time before that happens. But I do think that we can take these steps, and to the extent that we can educate our constituents and the public about the benefits and the risks of these vaccines, I think we'll go a long way toward achieving that sense of normalcy sooner.
Thank you, and I appreciate it. Like I said, it was just more for anyone out there that may be freaking out. I just wanted to make sure that we were clear on requirements and et cetera.
Yeah,
so.
No, I want people to ask questions. I want people to get clarification. I don't think any of us is well served by being confused or scared. I want people to reach out, and that means a trusted person. It may not be your doctor. It may be a priest. It may be any number of people in our community. We've got to have this conversation.
Through the chair to the administration, on that note, is there a specific, I know that I at least have had a couple of individuals indicate to me that they had sent emails and had not received responses from your department. Is there a specific email that these types of questions should be going to that would be better? I don't know where people are emailing, so perhaps they're not emailing to the right place. And again, I know that this is being watched by a lot of individuals, so for full transparency and clarification, perhaps that would also be helpful.
So COVID-19 at monroecounty.gov is what I would recommend. If you've got questions, you're welcome to call 753-5555. That's the COVID hotline.
Okay.
211 is also available for people who have questions about where to get their vaccine or how to sign up. We're particularly encouraging people who don't have access, let's say, to the internet, or would rather talk to somebody, to call 211, and we'll point you in the right direction from there to Lifeline or what have you to make those connections. But please reach out. We want people to reach out.
Wonderful. Thank you.
Legislator Lee,
Legislator Lee, you have the floor.
thank you. Through the chair to Dr. Mendoza, there's a real cultural issue with the trust factor of the vaccine. And one of the issues from religious, as well as not having enough time to really put in the scientific study as to if there's going to be a mandate for whether it be teachers or staffs or so forth to have the vaccine in order to stay employed. Have there been a decision on that one way or the other?
I'm not aware of any of those discussions, really. I'm focused on encouraging everybody to get their questions answered and to get the vaccine as soon as it is available to them and as soon as they're comfortable with it. But as to the regulatory part of whether it's required for certain jobs and so forth, that's not my area of expertise.
Okay, thank you.
Thank you. Do we have any other county legislators that have any questions?
Get the
Okay,
vaccine
hearing.
as soon as it is available to them and as soon as they're comfortable with it. But as to the regulatory part of whether it's required for certain jobs,
I think we need someone to place mute.
that's not my area of. Just hearing my own voice.
Yeah. Well, I do want to thank Dr. Mendoza for being here tonight, certainly for taking time out of your schedule to answer our questions. I do want to acknowledge that I did like that you acknowledged that questions need to be asked and that you're there to answer those. As representatives of Monroe County residents, we were hearing so many questions from our residents, teachers, staff, students, and it is our role as legislators to ask those questions on behalf of our constituents. So thank you for acknowledging that. Thank you for being here tonight to answering those questions that we have. And my hope as we move forward is that we can continue to keep this open communication between you and your staff. So thank you again for being here tonight.
Well, and thank you to all of you here tonight for welcoming me here. I think the beauty of Zoom is that I don't see an aisle. And what I heard tonight was a conversation among colleagues of people who are interested in nothing but the well-being of our students and children and this community at large. So I want to thank you all for your questions. I hope you'll continue to reach out to our office, to my office, to me. This has been a long year, and I think we will get through this if we continue to have these conversations and seek clarity from reputable sources. There are no shortage of inaccuracies on the internet and wherever, but I do think that if we can do what we all can to promote truth, I think we will all be better for it. So thank you all, and have a good night.
Thank you. Okay.
Greatly appreciated.
Thank you. Is there anyone signed up for public forum tonight?
There's not.
There is not. Is there new business?
There's no new business.
Okay. Are there any other matters to come before this committee? Okay. Hearing none, I do want to thank the county legislators from both the Human Services and the Rec and Ed for being here tonight and adjusting your calendar so you could be here. The February 22nd, 2021 special joint meeting of the Recreation, Education, and Human Services Committee stands adjourned. The next meeting of the Human Services Committee is scheduled for Tuesday, March 23rd, 2021 at 5:30 p.m. And the next meeting of the Rec and Education Committee is scheduled for Monday,